Most retirees expect Medicare to shield them from crushing healthcare costs. Yet a typical 65-year-old couple may still face $366,000 in medical expenses, with hidden gaps that leave many people blindsided. But what if the real secret to reducing these costs has less to do with insurance and more to do with your daily routine? There is a reason almost nobody talks about this, and it is the missing piece you need to see before you make a single retirement plan. Medicare begins at age 65, but the safety net many expect is full of holes. Original Medicare, split into Part A for hospital care and Part B for medical services, still leaves retirees exposed to deductibles, copayments, and coinsurance. A single outpatient knee replacement can leave someone with an $8,000 bill if they rely on Medicare alone. These costs are not rare exceptions. They are built into the system. To fill those gaps, most people turn to private insurance, either Medigap or Medicare Advantage. Medigap plans, sold by private companies, pay for costs that Medicare does not cover, like copays and deductibles. These plans are standardized, with Plan G and Plan N among the most popular. Plan F, once the gold standard, is now only available to those who qualified before 2020. Plan G covers nearly everything except the Part B deductible, and its flexibility to see any doctor nationwide appeals to many. But Medigap does not include prescription drugs, dental, or vision. Those require separate policies. Medicare Advantage often bundles extras like dental and vision and usually includes prescription coverage. But these plans work within networks, limiting your choice of doctors and hospitals. And while premiums can be lower, out-of-pocket maximums and network restrictions can catch people off guard. Timing is another trap. The 6-month window after enrolling in Part B is the only period in most states when you can buy Medigap without health questions. Miss it and you risk being denied coverage or being charged more for pre-existing conditions. For early retirees, the problem is even bigger. Private insurance fills the gap until Medicare starts, but premiums can be steep. The reality is clear. Even with careful insurance choices, significant costs remain. That is why reducing risk goes beyond paperwork. It demands a new approach to your health, and it demands you take control of the daily choices that drive long-term costs and well-being. Retirement brings a new kind of responsibility, one that cannot be outsourced to an insurance company or solved with paperwork. The real challenge is turning your attention inward and making your health your top priority. Think of it as your new full-time job. Every day, the choices you make about movement, nutrition, and rest shape not just how you feel, but how much you will spend on healthcare down the road. This is not about chasing perfection or living in the gym. It is about consistency, showing up for yourself day after day, because the cost of neglect is steep. Inactivity does not just make you feel sluggish, it sets off a chain reaction. Muscles weaken, energy drops, and everyday tasks become harder. Before long, doctor visits and prescriptions start to pile up, and so do the bills. Research shows that the body declines much faster when it is idle. Sitting too much, skipping activity, and letting routine slide can speed up physical decline more than aging alone. The good news is you have the power to slow this process and even reverse it. The mantra is simple. Exercise is not optional if you want to stay healthy and independent. It is not a punishment or a chore. It is a requirement, like brushing your teeth or paying your bills. The decision to make health maintenance your main job in retirement is the single most effective way to protect your quality of life and your wallet. The sooner this becomes part of your daily routine, the more control you will have over your future. Muscle loss is not just a side effect of aging, it is a biological certainty with real consequences. The process has a name: sarcopenia. Starting in your 40s, muscle mass declines at a rate of 3 to 8% per decade, and that rate accelerates after age 60. This is not a slow, gentle slide. It is a steady erosion happening beneath the surface, often unnoticed until weakness and frailty set in. Sarcopenia does not just make you weaker, it disrupts everything from balance to metabolism, and it raises the risk of falls, fractures, and chronic disease. The body's largest reservoir of strength and resilience is quietly shrinking unless you intervene. This loss is not just about looking or feeling older, it is about losing the ability to move, to care for yourself, and to stay independent. Every decade without action means less muscle, more vulnerability, and higher healthcare costs. The science is clear. Muscle decline is relentless, but it is not inevitable. Strength training is not just for athletes or bodybuilders. It is the prescription for anyone who wants to age well and keep healthcare costs down. Research is clear. 2 to 3 resistance training sessions per week is the sweet spot for most people in retirement. Each session should work all major muscle groups, using 2 to 3 sets of 8 to 12 repetitions per exercise. That is enough volume to drive muscle growth and slow the losses that come with age. The key is progressive overload, gradually increasing the weight or resistance as your body adapts so muscles continue to grow stronger over time. Quality matters more than quantity. Good form and steady progression beat marathon workouts every time. Stretching is just as important. A daily flexibility routine helps prevent injuries, keeps joints moving, and reduces the risk of falls. This combination, regular resistance training and daily stretching, lays the foundation for independence and lower medical bills as the years go by. Protein intake becomes more important as you age, especially if you want your exercise efforts to pay off. Many retirees do not get enough protein, even though the body needs more of it to maintain muscle and strength. National surveys show a large portion of older adults fall short of recommended daily amounts. Without enough protein, even a perfect workout routine cannot stop muscles from shrinking. Research points to a clear benefit. Supplementing protein can reduce the risk of sarcopenia by 15 to 25%. That is not a small number. Fewer falls, fewer fractures, and less time spent recovering from illness all add up to real savings in health and in dollars. For most people, aiming for a protein source at every meal is a practical way to meet the body's needs. Whether it is lean meat, dairy, eggs, fish, or plant-based options, making protein a priority in your diet supports the muscle you work so hard to maintain. At the gym, there is a man named Dave who stands out not for his biceps or bench press numbers, but for the way he moves. When most people first meet Dave, they guess he is in his 70s. The truth is, Dave was 93 when he started showing up regularly, and he recently celebrated his 99th birthday at the gym. He is not there for social hour or to pass the time. He is there to work. Week after week, Dave follows his routine, lifting weights, stretching, and moving with the kind of purpose you rarely see at any age. He credits that consistency with keeping him alive and thriving. Dave says without hesitation that he would have been gone years ago if he had not kept up his strength. His story is not about genetics or luck. It is about daily choices adding up year after year until the calendar becomes almost meaningless. Dave's example makes something clear. The habits you build now can carry you further than you ever imagined. Numbers tell the story in plain terms. A single hip fracture can cost between $35,000 and $45,000 for hospital care and rehabilitation. For many, that is just the beginning. Long-term nursing home care runs between $90,000 and $120,000 per year. Even a short stay for recovery can drain retirement savings faster than most expect. The cost of prevention, by comparison, is modest. Group fitness programs or basic strength training average a few $100s a year. Studies modeling these habits show savings up to $600 per person over a decade, simply by reducing the risk of falls and fractures. When multiplied across a community, these savings reach millions of dollars. It is not just about avoiding big emergencies. People who stay active and maintain muscle spend less on doctor visits, prescription drugs, and hospital stays year after year. The math is clear. Investing in your own strength and health pays off, both in dollars and in the freedom to live life on your own terms. In short, a relatively small, consistent investment in strength training and good nutrition can prevent catastrophic costs and help preserve independence throughout retirement. That payoff is real, and it is within your control. Right now, healthcare costs are rising faster than inflation, but the science is clear. Muscle loss and poor nutrition drive much of what we pay. Every choice you make today shapes your future bill and your independence. Your strongest investment may be in your own daily routine. Take control of your health now. Start with adequate protein, consistent strength training, daily stretching, and better food choices. Small steps add up to big savings and more independence as you age. Thanks for watching. Take action today, and your future self will thank you.